Doctors and nurses working in primary healthcare have an ideal opportunity to ask and advise their patients about their drinking. We have set up the SCALA project to see how we could help nurses and doctors in 3 countries increase the number of patients that they ask and advise. In Bogota in Colombia, in Mexico City in Mexico, and in Lima, Peru. What we know from previous studies is that providing training helps nurses and doctors ask and advise more patients. We also know that doctors and nurses find it much easier to do this work if they feel supported by their local communities. So in the SCALA project, we had 3 groups of providers. One group were working in primary healthcare centres where they got no training and no local support. Another group were working in primary healthcare centres where they got training. And a third group were working in primary healthcare centres where they got training and local support. Throughout the study, we kept detailed figures of how much it would cost to implement the programme, so to help people scale this up in other municipal areas and in other cities. We also estimated how much money could be saved by the programme by estimating the number of hospital nights and the number of alcohol-related deaths that also could be avoided because people were drinking less alcohol.
Screening and brief interventions are part of most packages of alcohol control policy around the world, as these interventions have been shown to be effective in reducing hazardous drinking. They're also cost effective, meaning that their costs are below a certain limit to gain 1 year of healthy life. However, not all programs who are cost effective also give a return on investment. Return on investment means that the benefits of a program, of an intervention, outweigh the costs of it, all in monetary terms. Return on investment depends on the following components. First, the perspective from which the return is assessed. For example, a healthcare provider or a society. Secondly, by the prevalence of people with hazardous drinking powers in primary care populations. Obviously, the lower the prevalence in hazardous drinking, the harder it is to achieve return on investment. The third point is the efficacy of the healthcare system, the costs of providing healthcare for the consequences which are going to be relieved by the intervention, and the data which is available. Based on these criteria, in general, SBI was found to be cost beneficial, i.e., giving a positive return on investment in some studies, but not all studies. In any case, when we look into the literature and the review, for example, of Ream and Barbosa has shown that most of those studies are modeling studies. And that means that they lie on some assumptions rather than using the data from countries, from empirical trials, or from randomized trials.
In SCALA, from the data we collected, we were able to run a return on investment analysis for Mexico by looking at healthcare provided by the public sector. We calculated the costs or the investment of implementing the SCALA program to ask and advise about alcohol. And we also calculated the costs that were saved or the return as a result of drinking less alcohol. We developed a simulation model, and we used the retrospective 10-year time frame from 2008 to 2017 to estimate how the alcohol consumption at population level would decrease as a result of implementing the different SCALA intervention arms nationally. Next, we translated these lower levels of alcohol consumption into the financial gains resulting from averted healthcare utilization. So, for example, nights spent in the hospital or emergency department admissions. And we also estimated the averted deaths that were also alcohol related within the 10-year time frame as a result of the intervention. So our analysis found that over a 10-year period, scaling up alcohol measurement in Mexico could lead to averting up to 16,000 deaths in a scenario in which every year 30% of the population would receive alcohol measurements. A comparison between the estimated economic investments, so for example, setting up the program or training the professionals, and between the economic gains showed that scaling up alcohol measurement in the scenarios that were tested in SCALA would have led to a positive return on investment. And that return on investment would be up to 85%, which means that the healthcare costs would be less than the healthcare savings resulting from the intervention. So in other words, for every $100 invested in delivering the program, $185 would be saved in terms of healthcare utilization. These results indicate that from a healthcare perspective, scaling up the alcohol measurement program in Mexico would lead to economic gains.
SCALA clearly demonstrated that providing training and local support increased the number of patients who were asked and advised about their alcohol. But the question is it worth the investment? In Mexico, we studied this and clearly demonstrated that it is worth the investment. If we look at the costs of overnight hospital stays that were avoided, the money saved was way in excess than the money that we actually had to spend on the program. In other words, the return on the investment was very positive, making it financially feasible to implement this program.